we're going to discuss one of the most overlooked issues in women's health today, and that is polycystic ovarian syndrome and the hormonal imbalance that comes with it. If you're interested in reading some of the resources, they're all listed down in the description box below, although I technically did all of the reading for you already. Polycystic ovarian syndrome is estimated to impact somewhere between 4 and 20% of women worldwide, but it takes years to be correctly diagnosed. There is no specific age at which manifests, but because of this long diagnosis periods, most women receive the diagnosis somewhere between the ages of 20 and 30. The so-called Rotterdam Criteria is used to determine which type of PCOS does a patient have and if one has PCOS at all. 4 different criteria are used: biochemical hyperandrogenism, clinical hyperandrogenism, oligoanovulation, and ovarian morphology. The presence of 2 or more of those determine the severity of the PCOS and also what phenotype of PCOS do you have. Hyperandrogenism relates to the hormonal imbalance that comes with PCOS and the excess of androgens, so male hormones in one's body. It is also the reason behind all of the symptoms that come with PCOS, such as acne, androgenetic alopecia, so male pattern baldness, hirsutism, which is excessive amounts of body hair where it shouldn't be, on the face, on the chest, on the back. Other parts of the pathophysiology of PCOS include chronic low-grade inflammation, insulin resistance that I talked about in my previous video, and not in all cases, but in the majority of them, obesity. There is not one single thing that leads to the development of PCOS. It is usually a combination of a number of different factors. Probably the most important ones are one's diet and one's lifestyle. If one leads a primarily sedentary lifestyle and the diet would predispose to the development of insulin resistance and type 2 diabetes and also becoming overweight or obese, those are all potential factors that could contribute to the development of polycystic ovarian syndrome. Gut dysbiosis, so an imbalance in the gut microbiome, is another factor that is being now thoroughly investigated for its role in PCOS, but there are no definite conclusions made as to in which way does it exactly contribute. Are there any specific bacterial strains which are responsible for this? Genes definitely also play a role, but not to the extent that you would expect them to. Researchers estimate that they contribute with no more than 10% to the total risk factors for the development of PCOS. Our environment is another thing that unfortunately contributes to hormonal imbalance, since there are a lot of chemicals called endocrine disruptors, which could have a negative impact on our hormones. The most popular ones you've probably heard about are BPA, bisphenol A, and phthalates, which are found in a lot of plastic products. I did a video on endocrine disruptors a while ago and what you should be looking out for and what is fear-mongering. You could check that out if you want. And the last 2 are alcohol and smoking. Smoking raises the levels of oxidative stress in our body, which contribute to inflammation. Alcohol is capable of altering the estrogen metabolism in our bodies, and it also contributes to the rise in inflammation and gut dysbiosis, which, as I already mentioned time and time again, are connected to the development of the condition. Now we're going to go over the diet and lifestyle interventions that one could undergo before opting out for any type of pharmacological treatment. The first and most obvious strategy would be to adjust your dietary pattern to one that would help manage the insulin resistance that goes hand in hand with polycystic ovarian syndrome. Since the majority of the cases of PCOS patients are overweight or obese, about 80%, there would also have to be a moderate caloric restriction, because excessive weight contributes to chronic low-grade inflammation and also does not help with the insulin resistance management. The remaining 20% of PCOS patients, which are called lean PCOS patients, they also suffer a lot of the time from insulin resistance, and without the caloric restriction part, all of the other things could be very beneficial. In research, it has been shown that even a 5 to 10% weight loss contributes massively to an improvement in the insulin resistance and also in the PCOS symptoms of patients. The dietary pattern that one would have to adopt for better blood sugar control would obviously be a diet that is not very high in carbohydrates. Somewhere up to 40% of the total daily calories should come from carbohydrates. Any super restrictive diets that are going towards even ketogenic diets have proven to be beneficial short term, but are not really recommended to the general population because of the unlikelihood of one to adhere to it for a longer period of time. It is not very compatible with one's social life. And secondly, there is really not enough research on these types of diets long term, and a lot of the people would technically consume less carbohydrates, but at the expense of more saturated fats and animal sources of fat and protein, which are not the best things to consume in excessive amounts for one's blood lipid profile. And if you're already overweight, obese, or you suffer from PCOS, there's a good chance that your cholesterol is not also looking very good. Dietary patterns that consist of whole foods, a lot of veggies, fruits, whole grains, lean protein sources, eggs, poultry, fish, dietary patterns such as Mediterranean diet, the DASH diet, dietary approaches to stop hypertension, or the Nordic diet, all of those have proven in research to be beneficial for the management of PCOS patients and insulin resistance patients as well. These diets are also rich in antioxidants and polyphenols, which help lower the oxidative stress in one's body and manage the chronic low-grade inflammation. At the same time, these diets would technically also be low in advanced glycation end products. I did not talk about them in my inflammation video, and this was a miss, but I forgot. Those products are generated when one cooks usually meats, red meat specifically, but also other things, under dry heat at very high temperatures. So you would be thinking grilling and frying. And there have been numerous studies done on them regarding their negative impacts on a lot of different things, on inflammation. This is one of them. But they have been tried for a lot of other things, including their potential to raise the risk of cancer. Other strategies that one can implement for better blood sugar regulation would be to shift your eating window earlier in the day. That does not necessarily mean that you would have to adopt an intermittent fasting regime. It means not to have any type of meal, especially a high carbohydrate meal, up to 4 hours before bedtime. This is not only going to negatively impact your digestion, but also your insulin response the morning after. Generally, research has shown that it's best to consume most of the carbohydrates at lunchtime. Breakfast is also not the perfect time to be eating a lot of croissants or donuts or anything like that. But generally, keeping the breakfast could help with hunger control throughout the entire day, since after consuming the breakfast, your body would release insulin, which postpones the release of ghrelin for later. Ghrelin is the hunger hormone that initiates our next meal. If this breakfast is absent, ghrelin, which tends to be produced by our body in higher concentrations later in the day, could influence us to have a larger meal than what we would usually go for. Last but not least, the specific food sequence that you might have heard about if you have been on the internet for the past 4 years would also help with blood sugar regulation, aka having your veggies, fruits, or soups first, then any type of egg or dairy or lean protein like a fish or poultry, then the red meat, and then having the complex carbohydrates. This has proven indeed to have positive effects on blood sugar regulation, but if you're having a mixed meal, this of course is not applicable. Therefore, it's good to be aware, but do not really obsess over this if you can't implement it. Doing all of the rest of the things that came before that is going to have a much larger effect than just doing the food sequencing alone. On the topic of physical activity, this is definitely not to be ignored when talking about PCOS and insulin resistance management. General recommendations are 150 minutes per week of moderate intensity physical activity, and if possible, include 1 or 2 resistance training sessions. In my personal opinion, resistance training should be a bit more present in these recommendations, but I guess they are made for people where the weight loss is the primary goal. So the idea is to induce a larger calorie deficit. On top of all of that, physical activity also helps with the mental well-being of PCOS patients, since anxiety, depressive symptoms, sleep disorders, those accompany a lot of the people who suffer from this condition, unfortunately, and the frequent release of endorphins can help with those things. Last but not least, the negative caloric balance that one would be in when performing physical activity and adhering to the dietary patterns that I discussed previously would of course contribute to the total amount of weight loss, which also helps with lowering the inflammation in one's body. Now, after I just explained nothing new to you and told you to eat healthy and balanced and work out, let's move into what types of supplements are being investigated for their influence on PCOS. Starting off with inositol, which is naturally found in beans and also in some fruits. This compound is found to be involved in glycogen synthesis and glucose transport, and this is why supplements that contain two of its metabolites have been gaining a lot of popularity and some attention from researchers. Most of the outcomes of the studies are indeed positive, but again, lifestyle interventions come first, and these types of supplements should come after that. If you like drinking tea in general, you might consider drinking more of the green mint tea, because apparently there's been some research that supports its use for PCOS patients because of the anti-androgenic effect it has. So it can lower the amount of androgens in your body. This would help with a lot of the negative symptoms of hyperandrogenism, such as acne, male pattern baldness, and body hair in places where it shouldn't be. Supplements such as zinc and vitamin D, which indeed are important for the overall health, support of immune system function, etc., those are recommended only if one has been found to have an existing deficiency in those specific elements. Otherwise, they're not going to contribute in any way to your overall health. Chromium and coenzyme Q10 also have some scientific papers behind them, but I believe that those are things that you should resort to if you have some money to spend. Otherwise, just focus on the rest of the things that we talked about previously. And if you don't want to make any type of change to your diet or lifestyle or anything like that, what would your other options be in theory when talking about pharmacotherapy? The one thing that you would probably be recommended in the first place would be to take birth control, but we all know that taking birth control comes with its risk, and you might reconsider it if you're concerned about your mental health or if you're concerned about blood clotting, for example. Insulin sensitizers such as metformin are being prescribed to manage the insulin resistance. GLP-1 agonists like Ozempic also are now being recommended because not only do they help with the release of insulin, they also most of the time induce a moderate weight loss because of the increased appetite and the lower amount of the food consumed, obviously. And this all contributes to an improvement in PCOS symptoms, in the weight status, and in the blood sugar control. Ovulation inducers would obviously kickstart ovulation, and statins could be prescribed if you have excessively high levels of the bad cholesterol, of the triglycerides. All of these, however, are temporary and costly solutions, and the positive effects of those would persist only while you're taking them, and the moment that you go off the prescription, there is no guarantee as to how quickly are your symptoms going to come back. This is kind of the same as with blood pressure medication, for example. You're taking your blood pressure meds, and then if you stop them, your blood pressure is obviously going to rise back up. Of course, in severe cases of PCOS, diet and lifestyle interventions might not really help to the extent that you would want them to, no matter how hard you try, and therefore a combination of both would be recommendable. However, resorting just to pharmacotherapy and going to the pharmacy for your prescription without implementing any type of change to your diet or lifestyle in my opinion, is not a correct strategy to implement, especially in the long term. I hope that now you have a clear understanding of this condition. I definitely have, and I feel like making the video helped me gain a lot more insight into this problem, since you're very little confronted with the idea of it unless you happen to have it. Thank you for being here with me today. I hope that you enjoyed the contents of the video. Let me know if you did, and don't forget to like and subscribe to the channel so you don't miss anything new from me. Leave down in the comments below if you have any type of suggestion for the next video. Thank you very much for watching, and I will see you in the next one.